Hi, I'm Jason, and this is my informative speech for speech class. Today we'll be talking about EMS, or Emergency Medical Service, and more specifically, have you ever wondered the difference between EMTs and paramedics? Now, EMS is a little different from state to state, but for the most part, it's basically the same. EMT, commonly referred to as an EMT basic, is an entry-level position in emergency medicine. They typically complete anywhere from 120 to 150 hour training program, typically at your local college or fire department. It is taught by EMT instructors who are certified with the state. They'll learn basic anatomy and physiology, basic treatment, as well as ambulance operations. In real life, their primary duty is driving the ambulance and assisting the paramedic with patient care. However, most of their training is actually on-the-job training because the driving portion is typically not taught at most EMT programs. On the other hand, a paramedic is also an EMT. Being an EMT is kind of a prerequisite to go to paramedic school. After completing the EMT portion of the training and someone enters into the paramedic program, it usually takes about 1,200 to 1,800 hours of classroom and clinical time. And they'll learn procedures such as IVs, intubation, pleural decompression where you can decompress a lung, pericardiocentesis where you stick a needle into the pericardial sac of the heart to remove fluid, tracheostomy. So basically they learn a lot more in depth anatomy and physiology, and they learn a lot more in depth treatment. Their primary duty in real life is patient care. They typically ride in the back, take care of the patient, they do all the documentation of the call, and they're in contact with the emergency room physician in a lot of cases. They work under protocols by the ER physicians without having to call them and ask them in regards to the patient. They kind of know ahead of time what they can do and what their scope of practice is. The history of EMS, typically the ambulance service used to be owned by funeral homes. It's always been said that the funeral homes paid better to transport like corpse rather than patients. So they would typically step over, in a car wreck situation, they would step over someone to get to the dead body because that paid better. And it's eventually evolved into what it is today. And it's always been said that paramedics save lives and EMTs save paramedics.